Welcome everyone. This presentation provides detailed step-by-step guidance on how to draw up and administer the Comirnaty or Pfizer vaccine, as outlined in the packed vaccine job aid. How to draw up the Comirnaty vaccine is featured on page 7 and 8 of the job aid. We will go through it step by step. Start by cleaning your hands. Follow an aseptic technique. Clean your hands well before vaccine preparation, between patients, or at any time if your hands become soiled. Next, bring the vaccine and diluent to room temperature. If the vaccine is in the refrigerator, remove it and allow it to come to room temperature for 15 minutes. The vials can be held at room temperature for up to 2 hours before mixing. If the vaccine is in a cooler box, there is no need to wait. Remove and start prepping. Before inspection and dilution, gently invert the vaccine vial 10 times by tipping it upside down. Do not shake it. If the vial is shaken, discard it. After mixing the vial, you need to check and inspect it. Check you are using the correct vaccine and diluent and check the expiry date on them. Then inspect the vaccine liquid prior to dilution. It should be a white or off-white suspension and may contain white or off-white tiny solid particles. Do not use it if the liquid is discolored. Then inspect the vial. Check for cracks or any abnormalities which might be evidence of tampering. Once you are satisfied with your check and inspection, you need to clean the stopper of the vial and allow it to dry. You do this by flipping off the purple plastic cap without touching the rubber stopper to open it. Wipe the rubber stopper with an alcohol swab before each dose drawn up. Allow the stopper to dry before inserting the needle. Once the stopper is clean and dry, you need to dilute the vaccine. Dilute it in the original vaccine vial. Use a 2 ml syringe and a 21 gauge or narrower needle. Ensure that the needle is attached securely. Withdraw 1.8 ml of sodium chloride 0.9% for injection, preservative free. Remove the needle from the diluent and before adding the diluent to the vaccine vial, pull back the plunger slightly to introduce a little bit of air into the syringe. This will help to get all of the diluent into the vial. Then inject this 1.8 ml of diluent slowly into the vaccine vial to prevent foaming. The next step is to equalize the pressure in the vial. Before removing the needle from the vial, pull it up slightly so that the tip is no longer in the liquid and withdraw 1.8 ml of air into the empty diluent syringe. Once diluted, gently invert the vaccine vial 10 times by tipping it upside down. Do not shake it. If the vial is shaken, discard it. The contents of the vial should be an off-white dispersion with no particles visible now. If it is discolored or there are particles present, discard it. There is now 2.25 ml after dilution, which provides at least 6 doses of 0.3 ml. Record the time and date on the vial that was diluted and add the new expiry time. It can be kept at room temperature, up to 25 degrees Celsius, for up to 6 hours. Discard any unused vaccine after 6 hours and do not return it to the refrigerator or freezer storage. To draw up the dose, choose an appropriate needle length. Use a light blue 23 gauge 1-inch needle unless the client is obese. If the client is obese, you will need a slightly longer needle to ensure delivery of the vaccine into the muscle. So use either a black 22 gauge 1¼ inch needle or a blue 23 gauge 1½ inch needle. Attach the selected needle securely to the vaccine syringe, which could be a 0.3 ml, a 0.5 ml or a 1 ml syringe. Carefully uncap the needle. Now you are ready to withdraw the vaccine and remove any air bubbles. Wipe the vial stopper with an alcohol swab and allow it to dry fully. Clean it for each dose drawn up. Hold the vial steady on a flat surface and insert the needle into the rubber stopper. Then pick up the vial and syringe and turn them upside down to withdraw. Withdraw 0.3 ml of the Comirnaty COVID-19 vaccine. Adjust the plunger to remove air bubbles whilst the needle is still in the vial to avoid loss of vaccine. Try to avoid tapping the syringe or vial. When drawing up the 6th dose, insert the needle into the rubber stopper at an angle to allow access to the vaccine in the corner of the vial. If you are repeatedly unable to draw up 6 doses, ask a colleague to check your technique and volumes drawn up at dilution and vaccine draw up. If the amount of vaccine left in the vial cannot provide a full 0.3 ml dose, discard the vial and contents into pharmaceutical waste. Do not combine vaccine from multiple vials to obtain a dose. If the vial is empty, discard it into the yellow sharps container. Lastly, do not change needles. Use the same needle that you have drawn up the dose to administer the vaccine. Never leave a needle in the vaccine vial between drawing up doses. If the vaccine is not administered immediately after drawing it up, safely cap the needle. In summary, to draw up the Comirnaty vaccine, you start by cleaning your hands. Then you bring the vaccine and diluent to room temperature. Gently invert to mix it. Then you check and inspect both the vaccine and diluent. Next, you clean the stopper and allow it to dry. You are now ready to dilute the vaccine. Once the vaccine is diluted, you equalize the pressure in the vial and gently invert to mix and inspect. Record the dilution time and date and the new expiry time. Then, to draw up a dose, you choose a needle of an appropriate length, withdraw the vaccine and remove air bubbles. Once the dose is withdrawn, do not change needles. How to administer the Comirnaty vaccine is featured on page 9 and 10 of the job aid. We will go through it step by step. At the beginning of each day, check the emergency tray or box is fully equipped and discuss team members' roles and responsibilities and processes in the event of emergency. To administer the vaccine, start by positioning yourself well. If not done already, complete the pre-vaccination health check on page 5. Protect yourself. Sit or stand sideways on to the client. Check that the client's mask is covering his or her nose and suggest that the client looks straight ahead. Lower your chair if possible so you are eye level with the injection site. Check the contents of the syringe. Is the dose correct? 0.3 ml. Is it an off-white suspension? No particles, no discoloration. Then expose the injection site fully. Ask the client to expose his or her non-dominant arm, the one he or she does not write with. If possible, ensure the whole shoulder and upper arm can be seen. The injection site is usually on the left arm unless the client is left-handed or has a rash, bruise, tattoo, redness, swelling, or other medical condition, for example an amputation, involving the intended site. Then use the right arm instead. Document the injection site on the EVDS if it is not the left deltoid. Ask the client to rest his or her left hand in his or her lap and relax their arm. Locate the injection site by finding the bony tip of the shoulder, called the acromion process. Measure 2 to 3 fingers or 3 to 5 centimeters below this. Use your other hand to form a triangle below this. The injection site should be in the center of the triangle in the thickest part of the deltoid muscle. Remember where this point is. Clean the site with cotton wool and water. Do not use an alcohol swab. Insert the needle by holding the syringe firmly between the thumb and forefinger like you are holding a pencil. Gently stretch and support the skin with the other hand. Avoid bunching the skin unless very low muscle mass. In that case, go to page 15 for guidance. Insert the needle at a 90-degree angle to the skin into the thickest part of the muscle. Insert up to the hilt of the needle. No silver from the needle should be showing, to ensure delivery into the muscle. Avoid pushing in too far and dimpling the skin. Stabilise the syringe and inject the vaccine. Move your other hand to stabilise the tip of the syringe. Do not aspirate, there is no need, as there are no large blood vessels here. Depress the plunger and inject the vaccine slowly. Ensure the full dose is given before withdrawing. Remove the syringe safely by pulling the needle out quickly and smoothly. Immediately after giving the vaccine, dispose of the needle and syringe safely in the medical sharps container. Do not try to recap the needle. Avoid filling the sharps container more than 3/4 of its capacity or up to the red line marked on the container. Apply light, gentle pressure to the injection site with cotton wool or gauze. If the client has a bleeding tendency or is on anticoagulants, apply prolonged pressure to the site after the injection. Avoid rubbing the injection site. Apply surgical tape to hold the cotton wool in place. Ask the client to stay seated for a few minutes to avoid risk of injury from fainting while you complete the records. Complete the vaccination card and give it to the client. If this is the first injection of the 2 Comirnaty doses, inform the client of the return date for the second vaccination. Give the client a post-vaccination information leaflet. Record in the EVDS or the vaccination site data sheet. Ask the client to remain for observation for at least 15 minutes after vaccination. If the client has known severe allergies, observe for longer, up to 30 minutes. Let's summarize how to administer the vaccine. Position yourself well. Check the contents of the syringe. Expose the injection site fully. Locate the injection site. Clean the site and insert the needle. Then stabilize the syringe and inject the vaccine. Remove the syringe safely and dispose of the needle safely. Apply light pressure to the injection site and apply the surgical tape and record and observe. Thank you for playing your important part in this rollout and serving the people of the Western Cape.